The biggest regrets that my patients tell me about. So number one is delaying treatment. You know, they'll be like, "Yo, Dr. P, you did say I need to do a root canal on this treatment, or I need to do a crown," but I was like, "Nah, the tooth is fine. I'm not coming back." Or, "You gave me the antibiotics and they helped. I never came back for the root canal treatment." I was like, "No, the tooth is fine. What's the point?" Or, "I didn't remove my wisdom tooth earlier. After you gave me those antibiotics and the pain subsided and the swelling, I was feeling fine and the tooth never troubled me." And when it started, I was like, "Oh my God, she did mention it. She said I need to come back." And I didn't. So, and now I regret, because now, you know, the other tooth is infected and I now have to remove 2 teeth. Now it's late and I even infected the neighboring tooth, and it's extremely painful. It's even more painful than it was back then. So yeah, that's one of it. The second one is not doing research. Some people feel like that because the media is telling me I need to do this, I see this. And most of the time, when patients come in and they tell me this is the kind of procedure they want to do, if it's not suitable for them, especially the cosmetic ones, you'll find a person probably with teeth as mine, but they want whiter teeth, or they want bigger teeth, and obviously I would discourage them from them and then give them alternatives. Some patients don't really listen, but obviously in my practice I would not continue with something that I am against, but they will go somewhere else. That is their biggest regret, because they'll just go there, do whatever, and then when they come back, now they have regrets and they are telling me like, "Yo, I regret that I didn't listen to you. You did mention that I don't need this. I basically need this, but I didn't want to listen to you," you know. Another one was, one patient had said, earlier in the years I looked really young, so she felt that because I am young and I'm looking, even the body is tiny, they're looking at this young girl, does she even know what she's talking about? And my prices were cheaper than where they've been, because you know patients, or you know yourself, you price hop. You go to this dentist, to the next, to get the best price. So apparently I was the cheapest and I looked young, and because of that, I was not credible enough for this patient. So they went to this other dentist. They quoted them, I think 5 times more. So they felt that because they've been quoted 5 times more, then it must be the best treatment ever. Years later, they're not happy with the results. They ask around, "Hey, I need help with 1, 2, 3. And people are like, "Hey, Dr. Buleni." They're like, "Huh? But I went there, I saw this young girl, the prices." I was like, "This girl doesn't know what she's doing." Then she came back, and then you're telling me that I need to go to her. Anyways, she swallowed her pride. She came through and she told me herself like, "Yo, doctor, I should have just trusted you. You were cheaper, and people you've helped, they are quite happy with your work. And here I am stuck with this treatment, and I've paid so much amount of money, like 5 times more." I was like, "Oh my God. Unfortunately, I can't help you, but yeah, it is what it is. And I'm grateful that you informed me about the whole ordeal that had happened to you. But I'm sorry about it." Yeah. Okay, another one is teeth grinding or bruxism. People feel like that is normal. Like, I've been chewing my teeth or grinding my teeth at night, or my kids or my husband or my wife has been doing this. I thought it's normal. It's just like snoring as well. People ignore it because they feel like, it's normal, to snore, but it is not. When you brux, obviously you hurt your TMJ, you hurt your teeth, you crack your teeth. Also the snoring as well, you might be having sleep apnea. So please check that as well, either with your ENT or with your dentist. Please check on that as well. So those are the regrets that people are telling me about it. They thought it's normal, Okay, another one is people losing teeth. They feel that because my grandfather, when he died, he already didn't have any teeth. My mom as well, or my aunt. It's in the family, but nobody is really questioning why is this in the family, why are we having to lose our teeth while the other families do not lose their teeth. It doesn't bother them, and they feel like it's a normal thing because it's in the family. Just because it's in the family doesn't mean that it's normal. So if you find yourself in a situation whereby all your family members are losing teeth and now you're in that predicament as well, please, let's just check. Come for a checkup, do the blood test, check what's going on with your overall health as well, because it might not only be teeth related but also your general health as well, and it can be passed down. Just like they say, diabetes it can be passed down from one generation to the next, but it takes you being in cognizance of it. Then you exercise and you eat well, and take care of your teeth. So if you know that in your family people just lose their teeth, and it's normal, it's not normal, please go for a checkup. But yeah, those are the things that people are telling me that they regret not checking that, because they feel like it's in the family. And then this one, people traveling to other countries, I won't mention by name, when they come back and then they need follow-up work, or they're unhappy with certain work, when they come through and they feel like, we thought it's cheaper because they covered 1, 2, 3 and they were doing this complex work, it's a fraction of the price that you quoted me, or South African dentists have quoted me. But they're not realizing that should any issues arise and they're back home, they won't be taking a flight every time to the dentist to check those things and fix whatever needs to be fixed. The follow-up treatment and the maintenance needs to be done by us while you overlook this. Yeah, so those are the things that some people regret, leaving the country or going abroad to do their dentistry, because they feel that it's cheaper. It's cheaper then, but it's more expensive going forward. Skipping the treatment or skipping the phases of treatment. For an example, a patient who's doing periodontal treatment will tell you, come 7 days, 3 weeks, 6 weeks, 3 months, and so forth, depending on, then it's 6 months after that, or 9 months. Depending on what we see, we tell you what, but that's in the normal sequence. People will feel that probably after 3 appointments, they're like, I'm good now, it's stable, because they're not seeing any symptoms anymore. They feel healthy, they feel good, the teeth are stable. They feel like, there's no point, the doctor said I need to come back, in whatever weeks, 6 weeks, whatever, 3 weeks, 3 months, but I'm feeling fine. And then by skipping that appointment, then they regress their healing phase. So should you have been given the dates of the phases of your treatment and the dates to come through for your treatment, please honor the appointments, go for those scheduled dates and finish the entire treatment. Don't stop just because you are feeling fine. Stop when the dentist tells me that actually now it's fine, you can stop the treatment, you're good. Okay, another one, the gold teeth. Some people are regretting having to put the gold teeth because of the effect that it does in the long run, because now they have to remove it and do crowns, which is more expensive. And you'll find that before they put in their gold tooth or silver tooth, we call it silver, we call them inlays. You'll find that people go to put in those gold tooth or silver tooth to look good, and then they cut the tooth that was just there was sound, it was not defective, it was not carious, and then now they have to do crowns, which is much more expensive, and they've caused more damage to their tooth than just leaving it the way that it was. Okay, some regret the thing that they did to themselves. For an example, some people file their own teeth and they cause themselves sensitivity. Some, they buy these fake gold grills or silver grills or diamond grills from online store, which are like very, very cheap, and they glue them on. I know one patient who almost lost his teeth because they glued those grills, which they are not supposed to do, but they thought they are saving themselves money, and they almost lost their teeth. So yeah, I would regret that too, but yeah. Most of the people, they regret using the toothpick, but at the same time they explain that that is the only thing they know, because it's called a toothpick, therefore it's for teeth. But it is not for teeth, it's for garnishing your food. But it's called a toothpick. I'll do a video about the toothpicks later on so that you can understand where the name comes from. But if you feel like you needed to use a toothpick, please use your interdental brush or a floss. I have videos on my channel that talk about that. But people, I mean, obviously after I've explained to them what the toothpick actually does to your tooth, then they have some regret because they didn't realize that they were damaging their own teeth. But obviously lack of knowledge and lack of understanding. Hence, I'm here to do more education just so that people can have the information and know the wrong things that they are not supposed to do and the right things that they need to know and do concerning their oral health or their teeth. Okay, yeah. All right, thank you for watching. In order for you to prevent these regrets, talk to your dentist, don't doubt your dentist. If you are not sure or if you're uncomfortable with the treatment plan the dentist gave you, go for a second opinion. It's always good, I always advise that. But after doing your research, listen to your dentist and have your second opinion, and listen to my videos, please. I talk so much about oral health education, and information is always out there. Please do that. And yeah, if you have any questions, or if you have any questions, please put them down below. And also, if you have any regrets that I have not mentioned you'd want to share with us, please put them on the comments below. Thank you for watching. See you on the next video. Bye.